My name's Elizabeth Tullis, and I'm the director of the Adult Cystic Fibrosis Clinic in Toronto, Canada. I've been involved in cystic fibrosis for 20 years. That's 2 decades of looking after adults with CF. I think one of the things that we're really excited about now in our care for people with CF is sort of changing the focus of involving patients and families in their care and getting their input. Our goal has always been to increase the life expectancy of people with CF and improve their quality of life. And we found that by incorporating the patients as members of the team, we can sort of reach our goal and their goals together. Patient and family-centered care is a philosophy of care where you're looking at the patient's perspective. And it tends to not happen sort of naturally in pediatric care because, of course, you have to deal with the parent who's going to assist in the care of their child. So they're, of course, involved. But when adult care, we tend not to sort of focus so much on the person with the illness and their family. We focus on sort of more medical, this is what the doctor thinks needs to be done. And it's really a philosophy of care where you realign things to think of the perspective of the person with the illness and their family to make sure you address their concerns. In order to involve patients and families in their care, one of the things we've done is we set up a patient-family advisory board, which we call PFAB. And this group meets on a regular basis and feeds information back to our quality improvement team about what their priorities are, what their concerns are with care, where they see problems. So for example, they'll come to us and say, we think the cleanliness of the clinic and the ward unit is substandard, or it's really difficult to get through to the booking office. Could we perhaps look at different ways of communicating with booking so that we're not just leaving messages and not hearing back? I think it's important that we hear from patients and families because the CF is a chronic illness, and chronic illnesses require a team approach. And you can't have a team approach without the key member of the team being present, and that's the person with the illness. Quality improvement in the CF world and in the medical world is really just looking at an approach to care where you're looking at outcomes and you're doing your best to provide the best outcomes for every single patient. It requires us to sit back and analyze the data we have to look at how our patients are doing, what kind of outcomes are we having, what is their nutritional status or their lung function status, and say, is that the best it should be? And in order to do that, we have to compare to other centers. We have to benchmark and say, our results are this. Is that a good result or not a good result? And then if it isn't a good result, we have to say, why not? And what can we learn from places that are providing better care that will allow us to improve the care that we give to our patients and therefore improve their outcomes?